Hi, my name is Janardhan. I am 67 years old. So I just want to recount an incident which happened to me a year ago when I was visiting a temple. I suddenly fell down on a slippery granite floor, and the impact was on my right shoulder. And suddenly I was unable to lift my hand completely, this right hand, and then I felt a sharp pain, and subsequently I was not able to do anything with this hand. So I was a little bit concerned whether what will happen to this hand. So immediately, I decided to come back and consult with Dr. Venugopal.
Mr. Janardhan is a 70 years young retired corporate employee. Unfortunately, he had a fall on his outstretched hand when he was traveling outdoor, and after the fall he was not able to lift the shoulder above his head. So he had problems or difficulties in doing the day-to-day activities like combing the hair and then wearing the clothes. And much more important was he had a passion for badminton and he wanted to go back and play badminton. So when I examined him, I noted that he has a rotator cuff tear, and because of which he was not able to have normal strength in the shoulder and not able to do the overhead activities of the shoulder. So rotator cuff is basically made from 4 muscles: subscapularis in the front, supraspinatus and infraspinatus in the top, and teres minor at the back. So these 4 muscles constitute rotator cuff, and this is very much essential to have normal movement of the shoulder and strength of the shoulder. So any tear in these muscles will cause weakness of the shoulder and causing difficulty in overhead activities of the shoulder.
He diagnosed it with a rotator cuff injury, that it was a rotator cuff injury and that it can be corrected by a surgery. So I had to get admitted into the hospital, and he led the team which did the rotator cuff surgery and stayed 3 days in the hospital. So he was all along reassuring me and supporting me.
So Mr. Janardhan, at any cost, he wanted to go back to sports, which was a passion, and the surgery went very well. We did a double row arthroscopic repair using only 2 or 3 portals, and post surgery he was very much motivated to do all the exercises, and by the end of 1.5 months or 6 weeks he got his full range of movements, and we started strength training, and the strength training went on till 3 months, and by the end of 3 months his strength was very good, and further he continued the strength training for next 1.5-2 months, and by the end of 5 months he was ready for playing the badminton.
So now the progress had been very good, and now I am able to do all my normal activities. I'm able to lift things. I wanted to go back to my badminton, do the swimming. I've also done swimming after that because it's more than a year now. Now I'm completely okay. So I go for swimming. I want to do badminton, and hopefully I'll be fully rehabilitated. So I'm really thankful for Dr. Venugopal.